University of London and campaign lead at Action Salt, Emma Pawson, the Head of Health and Wellbeing at the GLA, and Dr. Tom Coffey, OBE Mayoral Health Advisor. And Tom, I understand you might have to leave us early, but we appreciate your time nonetheless. Thank you everyone for joining us today and joining us here in the chamber as well. I certainly appreciate that. As my first time chairing one of these, I have to only look at who's in front of me. So I'm going to kick off first with questions to you, Tom, if that's okay. I'm going to ask you, what role can healthy eating habits play in improving the health of Londoners and reducing health inequalities?
Thank you, Emma. So I'm speaking both as a health advisor to the Mayor, but also as a GP. And I'm very aware of the quite strong links between diet and health outcomes. And also very clear that from a very early age, if you are able to make sure children have healthy eating habits 0 to 18, those habits tend to continue into adult life. If you're overweight as a child, you tend to be overweight as an adult. So the 4 or 5 key areas which I would say I would link healthy eating and to a good health and poor eating to poor health is, first of all, dental caries and dental health. We're very, very clear that high sugary drinks in children are ones which cause tooth decay, and there is a real big discrepancy between the richest and poorest in Londoners and the levels of tooth decay, a 300% difference. And so we know that is directly linked to the diet that these children take. Secondly, the other link, I suppose, is very much looking into adult life, into type 2 diabetes. Type 2 diabetes is very much linked to a diet very high in carbohydrate and linked to obesity. And also we see, again, a discrepancy between those people who have got a poor diet, a high calorie carb diet, tend to get type 2 diabetes. And again, there is a graded link between inequalities. The poorest Londoners with the poorest diets tend to have a higher incidence of type 2 diabetes. When you talk to Londoners about access to food and getting healthy food, one of the figures which I saw, which I found quite stark, was that the poorest Londoners spend 50% of their disposable income on food. The richest Londoners spend 11%. That is a massive difference, and therefore, the food costs for a poorer family really devour their disposable income budget. Also, one thing I'm very much aware of is as food prices go up, they don't go up in a unified fashion. Some of the evidence I've also seen is that the cost of food for the healthy kind of diet as opposed to the unhealthy diet, that one's gone up 5%, but the unhealthy food's only gone up 2.5%. So again, showing that grade of inequalities, whereby the poorer you are, the less disposable income you have, the more difficult it is to pay for a healthy diet, and the pressures on your budget often make choices about healthy eating very difficult. And I would see those are the strong links between inequalities and poor diet.
Thanks, Tom. Sonia, if I could come to you, is there anything that you could add on that?
Yeah, thank you. I'd like to just reiterate a lot of what Dr. Coffey has said there, that we know now that the food that we eat is now the leading cause of death and ill health worldwide, and London, of course, is no exception here. So we know that optimal diets with adequate amounts of fruits and vegetables, good amounts of fibre, protein and carbohydrates, that's what allows us to thrive and survive in society. But whilst we have these recommendations of what would be our optimal diets, looking at what the UK public are actually eating is far different. We know that we're not eating enough fruits and vegetables, nowhere near eating enough fibre, despite all the public awareness campaigns that might be out there for things like 5 a day. And we are all eating too much saturated fats, salts and sugars, and it's these kind of, let's say, harmful nutrients that are damaging our health over a prolonged period of time. If I could break that down a little bit, if you think about the amount of salt that we're having, we know on average in the UK we're eating far more than the recommendations, and there is a huge amount of evidence linking too much salt to harmful health. It's actually the evidence linking salt to poor health is stronger than most other kind of public health campaigns there. We know that if we continue to eat too much salt right from an early age, which we are seeing already, especially in London, that it will raise our blood pressure, and that's the number one risk factor for things like cardiovascular diseases, suffering from heart attacks or strokes. These are some of the biggest causes of death worldwide. So it's really important that we try and address this and try and improve our diets right from an early age, because we can, if we can have a healthier diet, then it will be beneficial on many accounts. You can have, for the individual, there'll be less pain and suffering long term and in the short term as well. They'll be more likely to work and provide for themselves and for their families. It will boost the economy as well. More people in work, less people not able to work long time. And it will also be hugely beneficial to the NHS. Fewer people that are sick, fewer people needing long-term care means millions of pounds being saved for the NHS long term there. Just to say specifically to London, we know that if we look specifically around obesity, the UK has one of the highest rates of obesity in Europe. London, you've got, I think, over 50% now living with overweight or obesity, and that's being seen right from an early age. So children starting school in reception, there's about 1 in 5 already living with overweight and obesity. So that problem has occurred right before they've even start school in the early years, which doesn't tend to get addressed very much at the moment. And then that increases up to about 40% by the time they leave their primary education. So it's really important that we tackle, and these numbers are rising over time. If you look at the 5-year trend, there is no sign of this improving at all. So it's really important that we try and address this. And as Dr. Coffey said, there's huge disparities between ethnic minority groups, between those who are more socially deprived as well. We're seeing greater rises in those living with overweight and obesity in these vulnerable groups of people.
Thank you, Sonia. And Ruth, if I come to you with the same question.
Thank you. I mean, I'm not going to repeat a lot of the things that have already been said, which are quite relevant. I just wanted to make a point a little bit about the environment that these people, and from my e-club perspective, specifically looking at young people, but the obesogenic environments that a lot of these people live in, where chicken shops are probably more immediate and definitely greater in numbers in areas of deprivation and food deserts. So not only is it harder for them to access maybe good food because of its cost, but also what they find on their doorstep is food that isn't healthy to them.
Thanks, Ruth. And just to let the panel know, we're coming on shortly to barriers to healthy eating as well, so we will be able to get right into that detail. Tom, I'll come back to you and ask how significant issues are obesity and poor eating habits in London?
So London has historically had the highest rates of childhood obesity in the country. And that was one of the reasons why, about 6-7 years ago, the Mayor decided to make childhood obesity a priority. Because we were looking at lots of public health indicators, and this is one whereby London stood out as very poorly performing. And therefore, that's why he's done a lot of interventions. You know, there's no magic bullet, but there is kind of thing, creating a structure to allow healthy eating to continue and to grow and to try to address obesity. So the figures, just trying to give some sort of comparison to the rest of the country. So there's 8 NHS regions in England, and then about a few years ago we were 8th of 8th for year 1 and year 6, the poorly performing for childhood obesity in the country. We're now, for year 1, we're 4th in the table, and for year 6 we're 5th. So in fact, the relative position of us for childhood obesity has improved. However, childhood obesity, hasn't gone away, and the figures for our year 1 figures are now presently 21.9% of children are obese or overweight, and for our year 6 it's 40.5%. Yeah, for adults, we've got at least 56% of adults are living with overweight or obesity in London, and that's much higher if you are a poorer Londoner or a Londoner from the BME community. So childhood obesity is still a big issue. Adult obesity is a big issue, and I think that this reflects, what's happening throughout the country. And I think our colleague mentioned the obesogenic environment is how do we change the environment which people live in to try to address those escalating figures. But yeah, I would say that it is still a significant issue in London.
Thanks, Tom. Tom, why is childhood obesity a worsening problem in London, as shown by the National Child Measurement Programme data?
So, the childhood obesity is worsening in the country. So childhood obesity is going up. But relative to the rest of the country, you know, London has improved. However, the reason it's still so high, and there are, I would say, probably a number of reasons. The reasons we mentioned earlier about the obesogenic environment, whereby you can walk in a poorer area, and of the food outlets in that area, 31% are fast foods. In a richer area, it's 20%. You need to kind of also recognise that the price of high carb, poor quality food is often much cheaper than the good quality fruit and veg. So they're often the drivers for it. I would say also we have found that the COVID pandemic, for 2 or 3 years, when children often were kept indoors, weren't able to exercise, so that had a significant effect on child weight, whereby the ability to go to school, get free school meals, go to school, to exercise, to also to go out to the park and on a regular basis, that was quite limited. So we did find throughout the country an increase in obesity. The figures more for the last year have gone down a little bit, but that is probably more a data issue than a real change, having looked at the figures. So they are still too high, but compared to the rest of the country, we have improved.
Thanks, Tom. And I think we've covered a lot of the mayoral policies, and I'm sure some other people might get into the TfL junk ban. Let's not do that today. But one of the biggest announcements we've had recently is £130 million for free school meals. Is there any caveats attached to that, or is there any way in which you'll be working with the mayor to make sure that that funding goes to healthy meals, or that those meals are provided in a healthy way?
Undoubtedly. So for free school meals, what we know is that for those people on free school meals, that has a 9.3% impact on weight change in children. So we know it benefits children compared to those children not on free school meals. Secondly, we also know that free school meals does have a benefit for children's educational attainment. The studies have shown that they improve in English and maths in the early years at school. So there is undoubtedly an amazing health benefit to have universal free school meals for all London children at primary schools from years, I think, extended to years 3 to 6. So it is something which does have a health benefit, and myself and the health team will be, involved very closely in making sure that the policy is rolled out. And because the evidence is already there that universal free school meals improves the well-being and health of children. And free school meals already, when we compare free school meals to packed lunches, we say, is there a difference or not? There is. The evidence shows they're more likely to have lower salt, lower sugar, and much more fruit and veg in a school meals compared to the packed lunch. So by that change in itself will have an impact on the well-being and the weight and diet of our children.
Thanks. Should I have a word with my 11-year-old? He certainly does not think his packed lunch is much more fun than school dinners. And so, but I get you taking the round, but of course, not always. But just specifically, and perhaps it's not something you thought about, but any kind of caveats or attachments to that funding to drive healthy lunches?
So there are already national standards about what school meals should have. And so, therefore, what we will make sure that those will be applied accordingly. Emma is working on this programme as well, and she will probably give us some sort of details. Obviously, for us as well, the free school meals is a massive advantage. But if you think of the wider school approach that we take, and there's 2 initiatives that I would mention as well, which are linked, I would hope, is one, water-only schools. So water-only schools now, we've gone from about 30 or 40 now to 459, water-only schools in London. We know, again, that has amazing impact on children's teeth, children's weight, children's behaviour, and children's educational achievement. The second thing we were also trying to link into the rounds, so it's not just kind of a single policy, is Healthy Schools London. Healthy Schools London, now we've got thousands of schools in London, over 2,000, who are Healthy Schools in London. The curriculum for that is very, very linked to having improved diet, improved nutrition, trying to adopt the Water-Only Schools programme, and also making sure that the approach to diet and nutrition in school is recognised throughout the school by the Healthy Schools London programme. So I wouldn't want to see the universal free school meals policy as it's a one-off. This is part of a whole programme approach we're taking of trying to improve the health and well-being of children in our schools in London.
Thanks, and perhaps, Emma, you could write to the Health Committee with more of those details as they emerge. Did anybody else on the panel want to add anything to that, and then I'll bring Andrew in? No, I'll bring you in now.
Thank you. The average UK school meals are mostly made of ultra-processed foods, according to a story in The Guardian. And that much as we want to drive to make sure that free school meals are of sufficient quality, what sanction will the Mayor have on those schools that decide to serve the kind of school meals that I used to have when I was a kid, rather than healthy meals?
So I have to say I'm not close enough to the operational detail that an answer to that question would require. So there will be, there's obviously going to be a process whereby what we're trying to do is replicate the benefit of free school meals throughout London. So we know the 9.3% reduction in child weight and obesity by those who take free school meals. So we're going to try to replicate that. Now, the intricacies of the policy, if you've got a school, let's say, who decided to give their children a free school meal, which is of very, very poor quality, that is a level of detail and of the system approach which I can't pretend to be close enough to.
But I mean, if that is the intention, the Mayor must have some kind of mechanism to improve the quality.
Yeah, so therefore, what we'll be doing is making sure that the free school meals offered presently to those who are eligible at the moment, if they have got an income below 7,300, is rolled out to all our London children. And what we know is that approach already has the benefit of a 9.3% reduction in childhood obesity. And therefore, we're trying to replicate that approach. Now, so there might be individual schools within that whole wide cohort of those extra 270,000 children who benefit, whereby the school meals might not be quite of the quality we would want. And I would hope there will be a process whereby we are trying to encourage and to make sure that that is being followed. But I can't say I know the contractual levers or details which one would deploy, to do that. But I share your concern that what we wouldn't want is these free school meals being of very, very poor quality. But our understanding so far, there's been 4 boroughs who've done this already, and they've implemented it. And I think Newham has gone from 45% to 90% uptake of free school meals. And as far as I'm aware, there's no evidence that the rollout and the expansion has resulted in a reduced quality. If anything, it's resulted in those children getting an improved quality of food, lower in saturated fats, lower in sugar, lower in salt.
I think people will look at, the Assembly is united, and just recently have been united in spending that £130 million in order to get that objective. We would want to make sure that we're getting bang for that buck, that we're not throwing £130 million at food that actually is not good for kids. And in many ways, also, you caricature packed lunches. Some packed lunches are extraordinarily healthy. And we're now in a situation where, because parents now know that they will have a free school dinner, that they may not provide that healthy packed lunch. And so actually, in some cases, if the school isn't doing their bit, then that could result in a worsening situation. So this is why the Assembly will be concerned about how that money is being spent.
Would you mind me bringing in Emma, who might just give us some extra information?
And I would echo that around the commitment to making sure that the children have a healthy and nutritious meal. We will be looking at how we can build it into the grant agreement that go out to boroughs. There's also a national pilot going on in Greenwich around improving school food standards that we will be looking at what lessons we can learn and then try and encourage other boroughs to take that up. And then just finally, I would say that one of the things that we are very aware of, this is a cost of living intervention. We have an increasing number of families who live in poverty. We have an increasing number of sad stories that we are hearing where children are actually going without food, or parents are going without food to be able to feed their children. So for us, making sure that every child has a hot, nutritious meal every day is vitally important for us. But I do take on board your point about building the standards into the grant agreement that we give out.
There's no denial that kids should have meals. This investigation isn't just about children, however, and it's about healthy Londoners. And Dr. Coffey, you referred earlier about poorer boroughs, poorer outcomes. It's not the case, is it? I mean, if you look at the figures for obesity amongst adults, overweight conditions and obesity in adults, it doesn't correspond to that caricature. We've got boroughs like, for example, Croydon at 61%, Bexley 64%. That's not a direct correlation, is it?
So overall, there is a direct correlation between poverty and obesity. Now, obviously, within London, you will get various boroughs whereby, not necessarily following that utter straight line curve, but a figure which kind of I thought that looked quite stark was if you look at the difference between Barking and Dagenham and Richmond, where there's a threefold difference in year one childhood obesity. So, and that is much more common, whereby those areas, and so whereby there is a greater level of poverty, there is a greater level of childhood and adult obesity. And I think if you drill down to, so we've got a borough, let's say, an average population of 300,000, and of course, overall a borough, you may see changes which aren't reflective of that analysis that I've just shared with you. But when you go down to much smaller population sizes, wards, enumeration districts, there you will see the very strong link that there is a direct correlation between poverty and childhood and adult obesity. And there's always a big difference between Kingston upon Thames and Kingston upon Hull, whereby there, and I know it's not an area we cover, but the difference in adult obesity there is very significant, and that's directly linked to poverty. I mean, colleagues of mine who are probably more academic and experts might also want to share some further information, but that's the analysis that we've got in London.
Thank you. And lastly, I don't know if this tramples on another question, but it just occurs to me that Miss Soroko, you're based in Hackney, my old borough, and I'm well used to. I used to run a youth club there, and I'm used to the challenges of trying to force fresh fruit down the throats of teenagers. It's a challenge, but you've got significant pockets of deprivation and wealth in Hackney. Can you explain what your approach has been in order to promote healthier eating? And you can explain why I failed as well.
So first of all, I just want to correct you a little bit. We are based in Hackney, but that's very much for our records. We are actually a pan-London operation, and so we work in partnership with youth organisations across London. We do work quite a lot in Hackney, but we work across other boroughs, and so we're not based anywhere. We come to the young people wherever they are, and the young people we work with are, I guess, what you would consider disadvantaged, the ones that might be homeless or might be leaving care, or those kind of young people. We have a team of professional chefs who deliver our activities, and all our sessions are delivered as part of courses, so we try not do one-off interventions. We come and we work with the young people sort of from the very basic to as advanced as a course can get. And for us, it's about slow and steady behaviour change. And so from the very beginning, if you come and you just say, okay, we're just going to give you healthy food and here's our vegan diet and this is what we're going to do for the next 6 weeks, I don't think we'll succeed. But we try and make it exciting, we try and make it delicious, and we try and sort of inspire them to make their diet more colourful, because I think a lot of young people rely on chicken as, I think, one of the main staple vegetables they eat. And so we're trying to take them slightly into other things and just give them a little kind of thing that they can take with them into their future lives.
Thank you, Chair.
Thanks. Assembly Member Russell.
Just very briefly, I just wanted to pick back up on Andrew's question about getting bang for buck for the 130 million on free school meals. And I've just got a question about procurement, because I remember in Islington when we went to free school meals for all primary school children, that came through a process where parents have been campaigning for better procurement of free school meals and of all school meals, and we were trying to get rid of the turkey Twizzlers. This was quite a long time ago now, 20 years or so, but I just wonder how many of these boroughs are going to be locked into school dinners contracts that potentially don't have the bits in the contract that prevent the ultra processed food or whatever. And I just wonder what kind of handle you've got on the range of contracts that schools and boroughs have with school dinners providers, because they don't all have dinners being cooked by school dinner people in particular schools. They're very often everything's provided through a sort of big catering company. And are you planning to intervene in terms of the borough procurement? If you were talking about having putting conditions into the grant for the money for the free school meals, and I'm just wondering sort of how that intersects with the borough and school contracts with the school dinner providers.
Yeah, so I'm going to start. I'm going to probably hand over very swiftly to Emma, who will probably have a greater understanding of the detail. So I think the message behind both yours and Andrew's question is, how do we make sure that this works well? That I think the principle of doing this now seems to be accepted. This is a good thing for Londoners and a good cost of living intervention, which also has health benefits, which is fantastic. And very much kind of, I would see, mimics that health and all policies approach that we have, Sadiq now takes across his wide portfolio. The detail that you're asking is about the value for money. I'm going to just ask Emma if she can kind of make a few comments, which, it is very early days, and it might be sometimes you're raising issues that we just need to take away, but and the questions which are appropriate for this kind of process that we're going through. So, Emma.
Thanks, Tom, and it is a really good question, so thank you. I think for us, we recognise that the complexity of what we're trying to do quite quickly. We are going to be meeting with the Association of School Caterers to look at how we can leverage conversations with them. But most importantly, we're going to be working with each of the boroughs to look at existing mechanisms. What we're not looking to do is to set up a very complex system that will cause borough a lot of extra work, not only just because this is a one-year intervention, which is around cost of living, but we will be looking at opportunities. So as you just described, there have been seen from the boroughs who currently do this, ways in which they can collect together and use their collective power to relook at their contracts. So just to sum up, we'll be working with the Association of School Caterers, directly having a conversation with them, but working through existing mechanisms through the boroughs. It will be through them that we look at the contracts. It won't be something that directly as a GLA we will be getting involved in that level, making it as simple and as streamlined as possible, but looking for opportunities where there are those that exist.
It would be really helpful if you could perhaps write to the committee with a bit more detail once that's scoped out, because the potential is absolutely huge for young people to get better food, and for after this year's intervention of this big lump of money that's being put into it as a cost of living intervention, which as Andrew said, everyone accepts is really helpful. But if there could be benefits in terms of future procurement being healthier, then that would be a really good outcome from that intervention. Thank you.
Peter.
Yeah, it's a question really, and my apologies if it's not my place to ask questions, but I'm more curious really from what you've been saying is, I wonder what the metrics are about a universal offer as opposed to a targeted offer, because obviously, we keep coming automatically back to cost of living and poverty and whatever, and so, does a universal, is it the best use of money, or would it be better to spend money on the poorer over a greater range of years? I just wonder what the metrics were.
I'd say, Peter, it's perfectly to make that as a point, almost through the chair, and then perhaps if Tom wants to say something on that. But I will say that we are running over time on this section, which was just our introductory section. So, Tom, if you did want to respond, if it could be brief.
Yes. No, not at all, not at all. I take it from all sides. It's all right.
I'm used to being here.
No, it's quite right. It's quite right. And so what we've recognised that poverty in London is quite significant. A quarter of all Londoners are facing poverty. 46% of families with children have reduced their food and buying because of the poverty. And therefore, we're very much aware that a universal system, is one which doesn't bring in a means testing system, which would be quite expensive and clumsy. And we've got a 6 months to implement this. And that universal system means that all children at primary state schools will benefit. And also, we will be doing an evaluation. So I think it's important that as we're spending public money, and as Andrew and Carolyn point out, we've got to make sure that we understand the impacts of what we're doing. So we are very committed to doing an evaluation of this project to see the benefits to those children, the 270,000 children who will be benefiting from this new proposal.
Thanks. Because it is, I mean, Peter, the point being, let's look at the impact of this on secondary school children. Well, there is none because we didn't, So, for example, I hope, Tom, perhaps that's again something that maybe you can send back, as you said, the metrics. We're all behind the thrust of this, but it's again around getting that bang for the buck, the health, and how we break down the success of that I think people are interested in. And Uncle, with that note of we're over time, if you can.
I will. It's a very short intervention. Look, Emma, I understand that this is, of course, a short intervention for a year, primarily to address the cost of living crisis. And I think that's the main primary, and the other things are add-ons. But the question which comes to my mind is, are the free meals so unhealthy at the moment in London that no one's addressed the issue? The assumption seems to be that we're getting it all wrong, right? That we need to now use the funding as to improve the quality of food being fed to our school children. There must be some national guidelines already on this.
Again, I'll start by bringing Emma in. So there are national guidelines on the on school meals and what is nutritional content. And you'll have remembered years ago Jamie Oliver doing a big campaigns about how do we improve the quality of school meals so the quality is as good, if not better, than what Emma's family have in their kind of packed lunches. And so there are national guidelines. This isn't starting from scratch, and Sadiq is working out what those standards should be. They already exist.
Thanks. And I'd just add to that, I think I fully support everything the committee said about making sure that this is nutritious food that the children get. But the sad facts are that even data that came out yesterday, the number of families that are living in poverty is just increasing and increasing. And the number of children who are going without food or can't afford a healthy, nutritious meal are just continuing to increase. And we know with the changes in the sort of energy caps that are coming as well, it's going to get worse. So this really is an emergency situation for families. The stories that we hear are heartbreaking. So that's our focus for this, is to make sure that every child can have a nutritious meal at least once a day.
Thank you, Chair.
I'm sorry, if I may, Chair. What is the main purpose of that policy then? I thought it was about promoting healthy eating, promoting eating, rather than. But you're now saying it's purely to address the cost of living crisis. What actually is the policy about?
If I can answer, I think sometimes policies are very useful to have more than one outcome, more than one benefit. And I think, what I like are those policies whereby you have an impact on someone's weight, someone's ability to afford to pay for food, to make sure it increases their health outcomes at the end of the day. And this is a policy which does a number of things, Andrew. So we are in the middle of a cost of living crisis. No one can deny that. And this is something which will give, for those families, £440 extra per year. So this will address that cost of living crisis. The added benefit is that it improves the diet and the weight of those children. So it's more than just one outcome.
I think we're in danger of rehashing, and I just want to... Sonia, is it super brief? Because I want to get onto the barriers.
No, it is very brief. It's just to say that there are national school food standards that schools and catering companies are supposed to abide by, but whether that's being implemented and who's monitoring that is still up for grabs. I know there's certain local authorities that are looking into evaluating the nutritional quality of school food meals, but that's not something that's being done across all local authorities and across the country. And I personally think that's I've got small children myself, and it's something that I often question in my kids' schools as well.
Thanks, Sonia. And we had wanted to ask about the impact of the COVID pandemic on obesity levels, but I think what we'll do is we'll write to you as a committee to get answers on that, because that could be another long-lasting debate when we want to bring people like Taz in, who isn't here just to spectate today. So if I could move on to our second section of barriers to healthy eating and pass over to Assembly Member Ahmed.
Thank you very much, Chair, and good morning, panel. I just wanted to pick up on something that Dr. Coffey said, and I think this is quite an important question. Do you expect London's childhood obesity rate to increase as a result of the cost of living crisis?
It's something which I think I'd be foolish to try to predict. But what I do recognise is that so we can look at what the stats show us, that the poorer you are, the more likely you are to be unable to afford healthy food. You're more likely to live in an obesogenic environment. You're more likely to take less exercise, and you're more likely to therefore have be overweight, obesity. So if the cost of living crisis is going to exacerbate those factors, therefore it would not be surprising if childhood obesity were to increase as a result of that. Now, what we're trying to do in London at the same time, is address many of those features. And the idea of the obesogenic environment, how do we kind of change that? And some of the things, I'm going to mention just two words, the ad ban, right, which has had an impact on the calorie consumption of Londoners. And that, again, is changing their environment. The idea that we're restricting or advising the restriction of 400 metres from a school of new fast food outlets. Again, changing the obesogenic environment. The promotion of water-only schools, challenging the obesogenic environment. So whilst the pure cost of living, making people poorer, having a direct impact and making it go up, yes. But I'm hoping that some of the things that we're doing as well will mitigate some of that increase. So it's very hard to predict the future, but we're trying to do all we can to address this issue.
Thank you very much. And Emma, if I could just ask you a question about free school meals. Do you think the closure of school kitchens over decades now has had a major impact on school dinners per se, but also in delivering the free school meals offer that we're going to have from the Met? I was asking Emma, but you're welcome to answer. If you've got the answer, then...
No, I didn't.
Okay. Yeah.
Thank you. It's one of the issues that we are working through. We do recognise that the capital issues and the staffing issues, the logistical issues are very stark for some schools. We are working very closely with the boroughs, so we are working hand in hand with both London councils and boroughs who are affected by this directly. We're looking at the boroughs who already fund free school meals for all children to look at what we can learn. It is an issue, like I say, that we are looking at the moment. We don't have capital built into the grant programme. We want every single penny to go to children directly so they can have food. So we've had a number of conversations looking at what opportunities are available. So, for example, in the past, DFE have given out capital grants, but again, that's going to take time. So we're looking at all solutions that are available. I can follow up with more details once we get through those conversations, but just to confirm that it is something we've logged and are looking at.
Thank you. As you will be aware, I have recently launched a report into childhood hunger in London, Growing Hungry, and I'm delighted to see that the Mayor has acted on some of the recommendations that I've made in this free school meals initiative over the next year. What I wanted to ask is, that's for a year, and we're very clear, and you've been very clear, that it has a number of attachments to it about the healthy living, improvement and food, the food quality improvement for children and outcomes, and also an emergency intervention in terms of the cost of living. In November, we had a budget statement from the Chancellor which did not address the issue of free school meals. Do you think that was a missed opportunity? Yes, both of you.
Yeah, I probably do. Because I think I've laid out what the benefits of free school meals, and therefore, I would hope that the intervention that Sadiq has done for the coming academic year will be a bit of a springboard, so therefore that the government might look and learn and say this is an intervention which we should be kind of copying throughout the country and extending beyond that year that we're committing to at the moment. So I would hope maybe, looking to the Chancellor's future budget statements, they may look at what's happening in London. London is quite a good incubator of some of these social policies, which I feel, will benefit, most Londoners. And if you look around the UK, so Wales are committed to going to year 6, Scotland are doing to year 5, and so we are the outlier at the moment, but not in London. So I hope that the Chancellor will listen to what and see what we're doing in London and make that a national policy. Definitely a missed opportunity.
Thank you. Emma, did you have anything to add to that?
No, I was just going to add the point that Tom has made, that other areas of Great Britain are doing this anyway. So we would hope that they would be looking across their peers and role model.
Thank you very much. My next questions are for other members of the panel, which I'm sure you'll be pleased to hear, Chair. So if we could start with, if Sonia, if you could start with this. What do you see as the main barriers to both adults and children developing healthy eating habits in London, and can education play a role in supporting adults and children to eat more healthily?
Thank you. It's interesting, we've been talking a lot about habits today, and I feel habits implies that it's a lot of personal decision. It's a personal decision of what we eat and what we put on our plates, what we feed our children. But actually, if we think about it, it's what's available to us. It's our environment, which has already been discussed today. We're effectively asking people to eat healthily, but we're not giving people the means in which to do that. Access, availability, affordability of healthy foods is a real big challenge here, I think. And as we've mentioned already before, the different areas, different levels of deprivation have different environments, different. The concentration of fast food outlets that Ruth mentioned before in poorer areas is really kind of exacerbating and encouraging people to eat these high foods that are high in saturated fat, sugars and salt, that are very cheap to buy, and that are essentially appealing to younger generations as well. And then you've got people with different levels of deprivation, where you have some people unfortunately do not have access to the right supplies in the house. No kitchens, no hobs, but no dining room tables. They're not able to feed their families healthily, and these things are really convenient. Unfortunately, we do live in a very fast-paced society. Convenience does benefit many people, and there is a place for these foods in the home, but we've now just become so accustomed to eating these unhealthy, heavily processed foods. There's so many campaigns out there available trying to encourage education and awareness, the 5 a day campaigns, but that's been going on for decades now, and we're still consistently eating well below the 5 a day that we're supposed to be having. We're not eating enough fibre, and it's because these highly processed, easily accessible, cheap foods are lacking in that nutritional quality. There's also loads of great things like community kitchens, food banks and things, but it's not really it's not targeting all demographics. It's not benefiting from most. You can see in places, I've got colleagues who do a lot of work in Tower Hamlets. They're seeing there might be some food banks there, but it's not really appealing for whatever reason to more vulnerable groups, maybe those ethnic minority groups as well. And these are people that do need that access to that information for whatever reason why they're not using it. I'm not entirely sure.
Thank you. And I think it's well documented that a lot of people now can't afford the energy to actually cook food because of the energy crisis. And thank you for highlighting that. If I can move to the other three members of the panel, could you tell me what you think are the main health inequalities that exist around healthy eating habits in London, and what impact will the cost of living pressures have on the diets and nutrition of Londoners? So Taz, if we could start with you.
Hi. So we see and hear these very questions that you're raising on a daily basis to the tune of like thousands of Londoners. We have a presence in several boroughs, so we do understand what's happening with health inequalities. The first emergency is if you're in a position where you don't have enough finances to feed your family, you'll feed them whatever you can. And that then opens a whole different area where the doctor was talking to us earlier on the left about health inequalities. Because if you're struggling to put the decent, healthy nutrition diet in front of your children, then that opens everything else. And children often follow the lead of what their parents have given them. So the barriers are obviously because of the financial crisis that we're living in, but it's only worsened certain demographics across London. So people already living in low-income areas and low-income families. Obviously the pandemic has increased that. Now people are facing a serious cost of living crisis because the cost of food has gone up like between 10, 20 and 30% to some items. The energy crisis on top of that is just, I mean, we're all feeling that pinch, even though a lot of us are in work, and then interest rates. So what do? You know, you're almost in a survival mode where you just want to put something in your bellies. All the other important questions about health and nutrition and nutritionally dense meals, they go out the window. They're secondary because you're in survival mode. So I think a lot more needs to be done. Yes, I do welcome the initiative from the Mayor. I think it's an opportunity to address a lot of other things, because if that's public money and it's being spent, I think there should be other interventions and other measures that we can address there while spending that money. So like there is a lot of schools that don't have kitchens. Where is that food going to come from? It's going to be created somewhere in a ghost kitchen and transported over there. I'm aware of contracts for contract caterers. 30 to 35% of your catering contract, it requires you to have fresh produce incorporated in that. We work with a couple of pilot schools in East London where we've doubled that value with surplus food. So we've kept the same value of the contract, but the offer of nutritional dense meals has doubled. So these are things that I welcome. Maybe I can share that with the chair to include that in a part of what Emma's doing and that policy, to see how that could be also modelled into looking at how we can offer that double nutritional intake. But also child hunger, Marina Ahmed, we have been supporting holiday activity programs. So we predominantly work with the two of the biggest operators, which are the Felix Project and City Harvest. We are their largest beneficiary. So I work very closely with the chief execs to address food insecurity for children especially during the holiday hunger programs. There is a solution out there, but it requires a partnership approach with policymakers and people that are in power like yourselves. And you need to come to the table a little bit and we can work together. And the solution is always, I find, lying in the problem that we're seeing. We took 40 metric tons of food, converted that into 50,000 nutritionally dense meals for some of the most vulnerable children in North West London. And we did that quite successfully with Brent Council and the leadership of Brent Council. So we've got a model that we are sharing with other local authorities. There is a solution to it, but it requires a very different conversation. So all I'm saying is we've got to think a little different because the times are very different. Thank you.
Thank you. Ruth.
Thank you. I think we are talking now, obviously, after years of pandemic and there's a cost of living crisis, but I think if we were to sit here 10 years ago and look at why people are not eating healthily, why children are growing up in homes where food isn't cooked and isn't shared, some of these things would have been the same then as they are now. I think it really depends on the ethnic background of where these young people come from. I think there are some cultures where good food isn't something that is built into the day-to-day, and these young people grow up with kind of limited palates. I want to almost say, I think sweet, salty, fatty is really easy to enjoy, and so if you have that rather than eating kale, then you probably would prefer to do that. So if it doesn't come from a home where young people grow up with sharing kind of complex flavors and home-cooked meals, then they will grow up not wanting it. And I think definitions of healthy food can vary, but I think a lot of it is food that contains a lot of fruit and vegetables, and that's not something that a lot of young people grow up eating or did grow up eating 5 years ago or 10 years ago. So I think that's something that we need to look at. And I think you mentioned education, and I definitely think education has a big role in that, because if they don't get that at home, then we need to try and provide that elsewhere, whether it's at school or in after-school provision, like the kind of work that we do. And I just want to make a point about, we're trying to show them that the good food doesn't have to be very expensive if you have the skills and if you have the knowledge. And so that's something that you can take with you for life.
Okay, thank you. And if I could point something out to you, you talked about ethnic minority cultures and that it being a particular issue. I think the issue actually is across all cultures, and poverty affects across the board. And I wouldn't want us to go away thinking that it's absolutely unhealthy eating is just particular members of the population. It is across the board, and I wonder if you would agree with that.
I definitely agree with that, but also I think you might not know which ethnic groups I relate to when I think about food culture. And maybe we can talk about it at another point. But I think there are some amazing foods that come from ethnically diverse populations that are brought here, and maybe some of the people living here just don't have that.
Thank you. Peter.
Thank you. Yes, I really don't want to rehash what's been said and trying to add, but I think there are a couple of specific levels. One is about cost of living, disposable income, cooking costs going up, and that's all been articulated fairly well. I don't think it has been mentioned that healthy foods actually are also unattractive to the poor people because they have a very limited shelf life. A tin of beans will sit there forever, but your kale will go off, your apples will go off if you can't force feed them to your 15-year-old. So that's just an unfortunate consequence. The second level, I think, is about knowledge and social restrictions and things, and they come from all sorts of areas about where you might want to source your food from, or where you feel your community will let you source from, or even your geographic location, makes a lot of difference as to what you can actually access. As a very small food bank relative to what other people are doing, we do try and put out a best practice model, and I think that's important for people going forward. We do encourage healthy eating. We spend about £1,000 a month buying in fresh fruit and vegetables, which is something perhaps other food banks wouldn't do. In a lot of places you would get your bag of food and it would be given to you and off you go regardless of what it is. We invest a lot of time in that, and we invest a lot of time in we have like a supermarket approach, but actually foods are sorted into different food groups, and you are expected to take some of everything. We can take the horse to water. We may not be able to make it drink, but actually, and I think that's a model that could be replicated in a lot of places. So we're making sure that people have different food from different food groups. education, of course, hugely important, but again, you've got to translate the education into action, and that's the difficult thing. But I think one of perhaps a crumb of very positive news is we work with a lot of young people. We have a lot of youth groups and whatever come and visit us, and actually their education about food is improved dramatically. They can talk knowledgeably about different food groups and what they should be doing. I think that's improved dramatically over the last few years. Whether that changes their behaviour, whether children are in the position to change the behaviour of their families, is a much different question. But at least one positive is, I think, in terms of actual education, young people in particular are better educated.
Thank you very much. Thank you, Chair.
Thank you. We're going to take a short adjournment now for 5 minutes, so we will return at 11:03. Thank you. Welcome back to today's Health Committee discussion on healthy eating. Apologies, it's a couple of minutes late, so I've got a bit of a dodgy limp, so I'm miscalculating how long it takes me to get places. For the next set of questions, I'm going to pass over to Assembly Member Boff.
Thank you. Just to go back on some of what we've said previously, we're talking about the cost of living pressures on diets. What impact do you think that the ULEZ will have on people accessing your services? Mr. Rogers.
I live in a borough that straddles the current ULEZ, so it's a huge issue for us. We don't have access to our own transport. We only have two vans that actually volunteers own. And if I want to go 500 yards into the south of the borough, it costs me £12.50 a time to pick up a donation. So it currently costs me £1,500 a year in ULEZ costs, and I expect that to treble. So that's £4,500 a year for a small food bank that I've got to find, which is essentially only going to go in tax. It's a tax on food banks, and so it's a huge problem already.
Are any of the scrappage schemes geared towards helping you with that regard?
They're not vehicles that I own. They're vehicles that belong to volunteers who move stuff for us. I can direct them to the scheme, I can show them the scheme, but I can't financially assist them. I don't own the vehicles, so I have to now try and look for volunteers who have ULEZ compliant vehicles, but I haven't managed to achieve that yet. A lot of the people that might help, are working people who have compliant vehicles, but then aren't available as volunteers to be able to help with food banks. So, sadly, for us, it's a direct tax on what we do.
Thank you. Mr. Khan, are you affected at all by the ULEZ charges?
I think everyone has to accept that the ULEZ charges are there, and there is an impact on everyone, some greater, some smaller. Fortunately, we get a lot of food delivered. We have 5 deliveries a day by the partner projects that we work with. So they're compliant with ULEZ. We have a vehicle that has to be compliant, so we are going to utilise the scrappage scheme for that, and then we'll convert ours to a ULEZ vehicle. So that's it. But going further than that, the organisations that we support, we kind of have a mobile operation where we go into estates and communities, so it doesn't affect the individuals and the beneficiaries so much as it would us as an organisation.
Thank you.
Thank you.
Thank you very much. Anybody else on that? Anyway, I'll go on to my main question now. To Ms. Pombo, what has the impact of the sugar tax been?
Generally, yeah. So that's one of the few public health intervention successes that I think we can confidently say has taken place here in the UK. It's the beauty in it has been its regulation. So the fact that it has been consistent, it's created that level playing field across all drink businesses to provide these kind of restrictions or reductions in soft drinks. Granted, it is quite an easy category to do, to reduce the sugar content in a liquid, and we've been able to see some real significant reductions in the sugar content of drinks. We know that sugar-sweetened beverages are a very big contributor to the sugar intakes of diets, particularly in children. So it has been a very successful measure, and we have been encouraging government to expand that to other categories of drink. For example, milk-based drinks, if you think about milkshakes, and even in the out-of-home sector, if you think about the growing businesses around kind of milk-based drinks that are contributing a lot to children's diets. It's something that we've kind of always advocate by regulating a measure and making sure that it's consistent throughout all food and drink businesses. You're creating that level playing field. We have had some voluntary measures, just moving away from sugar drinks. We've had some voluntary measures, obviously with the sugar reformulation programme, but also in salt reduction that's been going around for a number of years now, nearly 2 decades. And at the peak of its success, we saw some real successful reductions in the salt content of various foods. As I mentioned before, you've got that really strong link between salt intake and improving public health. But they have been voluntary, and we have seen in the last probably nearly 10 years or so a real kind of stall in progress within the food and drink businesses. There hasn't been as much. What's the word I'm looking for? There hasn't been as much kind of momentum, let's say. There hasn't been a strong enough power, I guess, within government to really push for reformulation. There hasn't been any kind of disincentives, I guess, for food businesses to do the right thing, because it has been a voluntary programme, and some companies are, let's say, more responsible than others, and it's now created this unlevel playing field where companies are not able to do as much as they would like, and regulating that would help. And the beauty of reformulation, so reformulation being altering the recipe of everyday food and drinks, is particularly wonderful, let's say, because it has the power to reformulate everyday food and drink products. If you look at the salt reduction programme, you have 80 different categories of food where companies are being encouraged to gradually reduce the salt content of things like breads, cheese, meat products, etc. And if we do these gradual reductions, it means that everybody benefits. So it does not discriminate against different demographics, social deprivation. All food and drink is reformulated, and it has those gradual reductions in salt content of everyday foods will lead to very large impact in public health. I think it was the Department of Health and Social Care had put these stats out that for every 1 gram of salt reduction in the UK population, we'd be preventing more than 4,000 premature heart attacks and strokes. These are really big numbers for a very simple ingredient that can easily be removed from the diet.
Is now the time to increase the costs of food, though?
I've not suggested that there should be an increase in cost. I think that the power and the importance of reformulation is that the responsibility is put towards the food industry to improve to improve the nutritional quality of foods. So that can be done simply by gradually reducing the salt content of foods. I guess you're referring to the soft drinks industry levy. So again, that should have been borne on to the food companies. So that the tax, let's say, was put on the food companies, the drink companies. If they had a higher level of sugar, then they would have to pay the tax. But obviously, some companies pass that on to the consumer. But generally, if you were to reformulate, companies do this all the time anyway. So reducing gradually, simply by removing the amount of salt or sugar, shouldn't have any additional costs, let's say.
But it's a sugar tax, and you've just called for a milk tax. That might delight Margaret Thatcher in another era when she was criticised for stealing the milk out of the children's mouths. Apparently it was the right step.
I wanted to clarify milk-based drinks, so not necessarily just milk, but the milkshakes and things.
But if we were to put additional taxes on sugar and milk and salt and all the other ingredients, that's going to be no cost whatsoever, is it? It's just free money.
No, so the purpose of reformulation and the work that I'm suggesting could be done is through the food industry, so not necessarily to the public who are already suffering from the cost of living crisis, but it's improving the nutritional quality of the foods. If you were to reduce if we use the levy as an example, if you reduce your sugar to a certain level in a drink, you don't have to pay that tax. So it's encouraging reformulation.
But you're saying reformulation isn't working?
Voluntary reformulation. So the soft drinks industry levy was a mandatory measure that was put across all companies. It created that level playing field, and it encouraged companies to reformulate and to reduce the sugar content of their drinks so that they didn't have to pay a tax or a levy. The salt reduction programme was a voluntary measure, and when the Food Standards Agency was in charge of it in the early 2000s, they had a very strong monitoring program, it was voluntary, but they put the pressure on food companies. They had regular evaluations, regular monitoring of the program, regular meetings to assess where the challenges are, and that had real progress. We saw reductions in salt content of everyday foods between 20 and 40%. We had some really good successful reductions in, let's say, breakfast cereals up to 50% reduced in salt. Bread were roughly about 20 to 30% reduction in salt, which is a really big success because it's the key contributor of salt to our diets. But it's not working now because there isn't that pressure. It's still voluntary, but there isn't that pressure, there isn't that monitoring or as strong a monitoring or evaluation in the programme now. I wouldn't like to suggest that we put a tax on salt that gets borne onto to the individual, but if you could...
Well, who else pays it?
Well, if you reformulate foods, much like the soft drinks industry levy, if you can encourage, the idea of it is to encourage reformulation, reduce the salt or the sugar content to a certain level so that you don't have to pay a tax. It's essentially incentivising reformulation so that companies don't have to pay a tax.
And what impact could the proposed government initiatives have on healthy eating outcomes? I mean, I'm thinking of the TV junk food ban and the ban on the buy one, get one free offers. So
there's lots of evidence out there kind of pointing you to the benefits of these schemes. There were lots of consultations that were done a number of years ago now, I can't remember exactly when, that looked at all of these different measures. And the idea behind it when the government first set their childhood obesity strategy is that they should all be done together, collaboratively. As Dr. Coffey said, there's no single bullet, there's no silver bullet that will tackle the obesity crisis. We have to look at the environment, we have to look at everything as a whole and do things together. Unfortunately, that hasn't happened as of yet. We have had these proposed restrictions. The advertising restrictions were supposed to come into place at the beginning of this year. It's now been delayed for various reasons. I would imagine there's a lot of industry lobbying there that's kind of, and with the cost of living being an argument to not pose these restrictions. I'm not entirely sure how that impacts the cost of living crisis. We're talking about advertising unhealthy foods here. There was no ban of advertising. It was purely a restriction on advertising unhealthy foods. And there's many companies, all companies out there actually have a healthier alternative that they could have advertised. But that's now been delayed to late 2025. There's also locations and promotions restrictions that would be really that would really help, again, address that environment in which we live in. So making healthier foods have a more prominent place in supermarkets, not end of aisles. Although I'm seeing myself when I go shopping, some supermarkets are finding loopholes in that, so they're no longer promoting things end of aisle. They've now got a nice little middle aisle selection. So they're following the rules but creating another one for themselves, let's say. And then you've also got the advertising restrictions, as you mentioned, the bog-off. That would have been a really good measure to put in place. There's lots of evidence that shows a lot of these bog-offs, as let's call them, are often on these very cheap, heavily processed, calorie-dense, nutrient-poor products. So if we were to be able to shift, again, those promotions onto healthier things like fruits and vegetables, which you don't often see, I think we'd all have a really important play to address that environment that I was talking about before. But unfortunately, all of these things are either being delayed or kind of being trickled in. And so we're not seeing the potential benefit that it could have because it's not being implemented in its full.
I mean, bog-off surely would be the same as introducing a tax that only poor people pay.
A lot of these bog-offs, and I can share with the Assembly a lot of the evidence that's been done on this by other NGOs that have looked into this in depth. A lot of the bog-offs do not actually encourage people. It doesn't save people money as much as it might mislead you into thinking you buy one get one free. If that kind of offer was applied to washing up liquid, let's say, you're not going to double up on the amount. That would be a good saving because you are going to be using the same amount of washing up liquid all the time. You'd be saving yourself on that kind of money, but you don't often see the bog-offs on that. You see it on foods like heavily processed foods, high in fat, salt and sugar, things, and we've seen research that shows that actually people aren't buying one, getting one free and saving it for another time. It's encouraging an increased consumption in these foods. People end up, if you buy 2 packets of crisps, you're more likely to end up eating those 2 packets of crisps within that week before your next weekly shop, and then you buy the same bog off. So you're actually buying 2 and eat it, as it's contributing to the obesity issue that we're currently facing now. Whereas if you had that on healthier food and drink, if you had that on fruits and vegetables, on healthier products, that could, hopefully help encourage increased intake in fruits and vegetables and less of those less healthful ingredients.
Do you have data that supports that contention?
I do, yes, I can share that.
If you could share that with us, that would be great. Thank you very much. Thank you, Chair.
Thank you. I almost felt like I should intervene as 2 members and guests continually told each other to bog off, but lovely. Passing over to Assembly Member Russell.
Thank you, Chair. So just continuing with Sonia, you've kind of you've been talking about supermarkets, food manufacturers, but I'm just interested in your views on how businesses, food manufacturers and brands can play their part in improving healthy eating habits. Is there anything, apart from kind of complying with all the reformulation and doing better, using their kind of all the piece about bog off that you've just been discussing with Andrew, is there anything else that you think they could be doing to really play their part?
For us, the main one is reformulation, so already improving the nutritional quality of the foods that we're already buying. As I mentioned before, it will help, it will benefit the whole population for all walks of life, different age groups, different demographics, different levels of deprivation, as well as the kind of buy one, get one free promotions and advertising. I think it'd be really good if they practiced more responsible promotion and advertising of those foods. Again, it's addressing that environment, shifting our purchasing patterns, purchasing habits, let's say, to those healthier ones. And I think what would also help is increased transparency. It's something, knowledge is power. If we were to know the proportion of sales that these companies make from selling and promoting their unhealthier products, that could hopefully encourage them to shift sales to their healthy alternatives, because a lot of these companies do produce healthier versions of foods, or have, if you think of any kind of breakfast cereal company, you'll have the worst of the worst, but there'll also be healthier alternatives. And it's about shifting their practices to promote and encourage consumption of those healthier ranges of foods. So I think transparency is great. But the problem is, as I mentioned before, it's just there's no regulation here. At the moment, we're just kind of really relying on companies' kind of ethics and goodwill, ethics and goodwill to kind of make a difference to the population that they're feeding.
Thank you. And that's really useful summary. So,
Assembly, I just think Ruth wants to come in.
Oh, yes, Ruth.
Sorry, even though this isn't necessarily my area of expertise or why I'm here specifically today, but I think one issue that is with foods in retails is labelling, and I think there was a lot of discussion in the past about how people can look at a product and know first and quite quickly whether it is healthy and unhealthy, and that goes back to the traffic light system which came, and then it was something that was again not mandatory, and some people put it, and some retailers and some manufacturers put it on the labels. But I think if there is some kind of way that makes people pick up a product and know immediately whether it is healthy or unhealthy, that would make it easier for them to know which product or version of a same product to pick up. And mandatory labelling doesn't really exist. Obviously nutritional makeup and ingredients are, but I think the traffic light system could have been a great way to enable that.
Is there a problem with so the traffic light system would say butter or olive oil are very high in fat, but actually consumed in moderation in small quantities can be part of a healthy diet. So is there a danger with a traffic light system that it kind of simplifies, so you could actually have very processed food that fits into the traffic light system that's kind of that comes out as seeming okay, where you've got unprocessed food that might be flagged as being red for being high in fat, but actually can still be bought to be part of a healthy diet. Is that a problem with that system?
I think when you buy oil, it's quite clear that it contains fat. So I think it was more beneficial for the processed foods for people to understand the level of how processed they really are and what the content is, without having to look at specifically what percentages of sugar it contains or salt. Because when you look at ingredients on the label of something, there might be sugar in 4 different ways that you might not be aware of, because it's made up of all kinds of different ingredients. But if it's then just put together in one big red, green or orange, then you would know this is high in sugar, this isn't high in sugar.
Yeah. No, I'm just thinking things like lentils, rice, the unprocessed foods sort of need like a complete green star category or something, because actually the purpose of that kind of labelling is presumably to alert people when they're buying highly processed foods that there are bad ingredients that might be health harming hidden within them. Sorry, Sonia,
if I could just echo what Ruth said, I think it is important that we look. It's more beneficial for the more processed products, and I think what's great about the front of traffic light labelling, which we're advocates for, is that transparency. It does help make people more aware of what's in it, but it also kind of holds companies to account. And if you're in a supermarket and you're looking at different ready meals, if they all have that front of pack labelling, you'd be able to compare between different brands, between different types of ready meals. I don't think it's not that useful for unprocessed, let's say more natural products like olive oil or dried beans or something. But it is for those processed products, because a lot of the time you'd be surprised how much salt is in a ready meal or in a packet of biscuits even. Something that's sweet does have salt, and likewise something that's a savoury dish would actually be quite high in sugar. So it's just making people more aware, and also speaking with many food companies, having that front of pack labelling does incentivise and just encourages them again to reformulate, because they don't necessarily want to have an amber or a red warning label for sugar on a ready meal. So it encourages them to improve the nutritional quality.
Okay, thanks. That's really helpful just to have clarified that. So for Emma and possibly for Sonia as well, how can London's streets and public places be better designed to facilitate and incentivise healthy eating choices?
So that's a really good question. I think there are things that the Mayor has already stood up and shown great leadership with. So one example would be with the London Plan, where he brought in a new requirement within the policy to restrict fast food outlets within 400-metre zones of schools, and also where there's a high density in high streets. And we have seen that boroughs have been taking that up and adding their own supplementary guidance. Changing a high street is not an overnight thing that can be done overnight either, though. It does take time. Walking around London in the areas that many children travel to on the way to school, you will start to see shifts as well. We are starting to see less fast food outlets, less pound shops, that kind of thing. The other thing that the Mayor has championed and helped fund is the healthy catering commitment. So that is a set of standards that food outlets comply with, where we try and shift what they sell into more healthy products. And that has now just been expanded to smaller and larger outlets as well. So there's just 2 examples.
Is there a kind of a badge that they have on the front of the shop, or I'm not aware of that healthy food standard?
There is a kite mark that I don't know if it's an official kite mark as such, but there is a standard that they can stick on their door. Whether or not they do it or not, I wouldn't be able to say. It's something that the Environmental Health Agency environmental health officers oversee and deliver. But we can share the set of standards that they work through to be able to comply with it.
That would be useful, and it also feels like something that maybe there should be some more publicity about, because actually people, like to. I mean, people presumably broadly want to eat food that is going to be healthy and good for them. So, kind of having some public awareness of that is potentially helpful. Sonia, did you want to add anything on that?
Just on the out-of-home sector, I think it would be great if more could be done on a local authority or within the London. The more that the mayor can do to improve, because if you think about nationally, the big food companies, they're all, I guess, already being addressed, and that there's some work that's being done there. But the smaller businesses, the more local businesses who perhaps don't have the knowledge, the awareness around healthy eating, and they might be smaller, family-run companies who are just making ends meet. I think if they could have some more support from a local authority, and I've heard of the healthy catering commitments. I think if there is more funding or more that can be done there to encourage that engagement would be really good, because out of home is, especially during COVID, where you have, and with the delivery apps now as well, where people access to food that is purchased and made outside of the home is ever increasing, and I think it's important that gets addressed.
Yeah, no, that's useful point. So I now want to think more about sort of community organisations and community food provision. I mean, I'm aware there's a whole movement of community fridges and sort of transition groups kind of running community fridges. The broad question, which is for Taz, Ruth and Peter, is what role can community organisations in London play in reducing barriers to healthy eating? So Taz, do you want to start off?
I think they have a very crucial role, because they're nestled often grass-rooted communities. And they're very aware of the local demographics of the people that they support and speak and talk to on a daily, weekly basis. Education is key. We have a strong emphasis on education. So running a traditional food bank of 5 or 10 years ago is not how we operate. We operate in a very different way. We have a holistic approach. We enable communities, empower them with knowledge and education. We have a large cohort of our service users that are on education courses, and the education is in different tiers. So we run education programs for children, because we have access to several green spaces as well, where we actively encourage youngsters to understand where their food comes from, the whole food cycle. We also run cookery schools, where we encourage the parents to come with their children and cook together, and often it's reverse education, because the parents only pass the knowledge on that they know. Now the children are reverse teaching the parents and saying, listen, actually I don't want chicken and chips. I want some healthy broccoli stems, and I want some this and that. So that has been a great success for us. And
so what kind of settings is that happening in?
It's a MasterChef kitchen, obviously. So it's a fully integrated cookery school, and you are all more than welcome to come and visit. And,
oh, wow.
And then I can give you some ingredients, and we can put some healthy food together.
Oh, that sounds like a great health committee visit for the future.
I think just to pick up, the committee, I'm sure, would love that invitation, as if you could send that
You're welcome,
through.
And we can all be judges and panels, and we can then judge the health and nutrition and value of the food that
see
you
how we
create.
do with the lentils.
So what we do, we kind of we take the seriousness out of the serious issue which is at hand, and we put it in a fun environment. Parents bring their children after home time to our cookery schools, and then we often have fresh produce which some of the parents don't know what to do with. Like, you'll be surprised when people see artichokes. They often sit there looking at it and not knowing what to do. So we have that education, because we've got some amazing chefs who have that knowledge, and they're passing that knowledge back down. That is how I believe we're going to achieve systemic change. You have to have education enabled in everything that you do. So,
Brilliant. So, education. Ruth, did you want to come in? And I think you may have something you wanted to clarify from earlier as well.
Yes, thank you. Just, quick clarification. We were talking about the different makeup of the ethnicity of the young people that we work with, and I made a comment which wasn't very clear, and I just wanted to say that sometimes we find that young people we work with who come from working class white backgrounds have maybe not as big exposure to spices, seasonings, and other cultural foods that you might find with other diverse groups that we work with. So just to put that one to rest. And I think everything Taz said, I'm probably going to say as well. I think community organizations are just there to be another way of enabling people in the community to get together, to experience food together, to understand where the food comes from. And I think education is definitely key.
Mm-hmm. And Peter?
Yeah, I think the value that community groups give you is also, and it follows on from Taz's holistic point, they give you the opportunity to support people in many ways beyond food. And so, we are essentially a food bank, but we run a free community cafe one day a week as well, which gives everyone the opportunity to come together. And we provide a debt recovery counsellor. So you go from, directly food to the whole cost of living issue. And we have a retired social worker who's renewed her qualification, so she can also direct people to funding that they should be able to access. And people buy into that because it's a trusted local community. Mm-hmm. We know the people, they know us, it's regular, and that's the biggest value, I think, of the community aspect, is being trusted and giving that access to other needs. So they will trust the information that we may be giving them on healthy eating. I just keep coming back to Taz's point. All through the summer, there was a glut of squashes of 48 different varieties. I mean, vegetables, not fruit squashes. And the discussions about what you do with them on a weekly basis with the participants was quite entertaining. We got to quite a recipe challenge by the end of 6 weeks of what else can you do with a butternut squash.
Did people enjoy cooking them?
Yes, and it was entertaining, and it became a challenge because the volunteers were saying, I have no idea what you do with this, I have no idea what you do with that, so we'll find out together, and we'll do that learning, we'll do that knowledge, we'll do that education in a trusted, safe environment. And you don't get that value with bigger organisations which are more detached and more remote, not deliberately, but that's the nature of them. So community gives you trusted organisations.
But I'm also, yes, it's also really interesting that so this is in a food bank context, that you're kind of actually kind of expanding people's understanding of what to do with different vegetables. And given that it sounds like we're all going to be living on turnips forever going forward, tomatoes, apart from the ones we grow ourselves, will become a thing of the past. But having that ability to make good, tasty food out of unusual vegetables is actually a really powerful thing, because it means you can cook with things that are in season, which are in glut and therefore a bit cheaper and more available. And
we're also very careful not to replicate. There's no point in us setting up another community kitchen. We have an organisation half a mile down the road called Organically, which does more or less, what these good people are talking about. So there is no point in us replicating that. What we would do is put a group of 6 people together, and they would go off to Organically, who have the facilities and whatever. So we do bridge the gap. We do provide information, but we don't try and replicate what everybody else is doing. And I think generally the sector is quite good at not doing that. There's not enough space for us all to be doing things and sucking up public resources. So we work very hard at bridging the gap and working with local organisations, and networking is the other advantage of local communities.
Brilliant. Thank you very much. Back to you, Chair.
Thank you, Assembly Member Russell. And passing over, we're going to move on to our next section, the Mayor's commitments and programmes on healthy eating. And Assembly Member Sahota will be leading us on.
Thank you, Chair. I am going to move the section, but before I go into that, I just want to explore some of the things you've been discussing, Sonia. We've been talking about healthy foods, advertising. Some people call it sugar taxes. I call it incentives. Manufacturers of food are there for one job only. That's to sell their food. And what makes the addiction level go up is the salt content, is the sugar content, the colouring going on there. Cigarettes manufacturers are in the business of selling the cigarettes. Even going to the extent of breeding the tobacco, so this is more addictive, right? And therefore, we need to give incentives, right, to these manufacturers to change their behaviour, and that could be called a tax, right? But I'd call it an incentive, right? But there's also a role for the government, right? Okay, in making sure that these manufacturers are acting responsibly. So, do you think that the government could do more, right, to encourage manufacturers to put the right sort of food on the plate of people who rely upon them?
I completely agree with you. Yes, there is. It has been, we all know the links between smoking and health. It's very similar now when we look at poor diets, that they are the leading causes of death in health worldwide. So there should be more done. And, we've seen with the government's childhood obesity programme and all the incentives that they had on that, and all the ideas that they had in that collectively would have made a really good, has the potential to have a really beneficial impact on public health. They just haven't been actioned to its full potential yet, and it's all been kind of, as I said before, trickled down in very little steps. You've got the voluntary salt and sugar reformulation programme. The sugar reformulation programme is actually finished now, so we're awaiting the next steps because it's by no means achieved what it was its desire. You have the soft drinks industry levy, mandatory, did work really well. That could be expanded, and all the other measures that they had in place are still awaiting to be actioned. For whatever reason, there is a delay there. So I think definitely incentivising companies through regulation is probably the only way now, because voluntary just has not been has not worked in the last decade or so.
Yeah. I mean, the power of all this marketing, and it can be seen, right, that when you're standing in a checkout of a supermarket, an apple costs less than a bar of chocolate.
But it's not at the front.
But it's not at the front, and the mother of that child or the father of the child is under the pressure to buy that chocolate, although I know the apple is more healthier and cheaper, right? Some sort of pressures going on, which is beyond cost, right, in the minds of people, okay? And just one more thing while I finish on this, that improving the air quality to reduce the death rate of 4,000 people in London by using ULEZ, I think is a welcome sign, and leadership by this mayor is a part of the incentive programme that we need to bring about change in society.
I agree.
Thank you for that. But let me just come to Emma now for you. What progress has been made on the commitments contained in the Health Inequalities Strategy 21 to 24 in enabling children and adults in London to develop healthier eating habits?
Thank you for the question. So we're just about to embark on a summary report for this year to look at all the commitments. But I'll give you an example of some of the things particularly related to the healthy food commitment and the Best Start in Life chapter. So the Mayor agreed to launch a child obesity task force, which he has done. That task force brought together a whole range of experts, right from members of the community and voluntary sector, academia, commercial sector, head teachers. They did some very detailed research looking at what was going on. They did ethnographic studies of children, following them throughout their day to look at where the opportunities and where the barriers were to healthy eating for that child. On the back of that, they launched their report, which challenged us in London across 10 areas. I'll give you 5 things that the Mayor has done in response to that, which do fit into your answer around the health and inequality strategy. So number 1 is the London Plan, which I've already mentioned. That now restricts fast food outlets within school areas and on the high street. Number 2 would be the water-only schools, and we heard earlier from Dr. Coffey that we are now at nearly 500 primary schools who are water-only. Number 3 would be improving breastfeeding. We're taking a multi-sector approach to that and looking at how we can reduce stigma, improve uptake of breastfeeding, and be better supportive to our mothers in London. The next one I'd talk about is super zones. We are exceeding our target, so this is creating healthy urban environments around schools in London, particularly those are the biggest areas of deprivation. We hope by the end of our grant programme we will have 90 of these in place, and they're doing some phenomenal work. The work is being co-designed with families, with schools themselves and with the local boroughs to change a whole range of things to make those areas around school more healthy. And then the final one, which I will mention, there's lots that I can mention.
Sorry to interrupt you. Is there any chance that you can either move yourself forward or move the mic slightly closer towards you? 'Cause just some difficulty hearing you on the feed.
Is that better?
If you can move this, perfect.
Hopefully you can hear me now.
Thanks. Sorry.
No worries. And then the final one I talk about, so I've talked about super zones, I've talked about London Plan, I've talked about breastfeeding work as well. And then the final one that the I've lost my train of thought, just bear with me. The 5th one.
This was the most important one you want to talk about.
It was.
I wish I could read your mind.
We are doing some work directly with the commercial sector as well. So there are pilots going on around the super zones, working directly with convenience stores to look at how we can work with them to offer more affordable and more healthy food to children who go to school in that area.
Okay, great, thanks. And what impact has the TfL junk food advertising ban had on the reducing Londoners' consumption of unhealthy foods? And has this been evaluated?
So the policy has been a phenomenal success. It was independently evaluated by 2 academic groups, and that was peer-reviewed. What that study showed us was that, on average, our families per week were eating less calories, which were the total effect of 385 calories less per week, which if you were to equate that to a chocolate bar, you'd be looking at around 1.5 chocolate bars per week.
Okay, thank you. And I understand that the government is minded to have a pre-watershed junk food advertising campaign also starting, but they're delaying it to 2025. Would it be better to bring it forward, do you think? You can say yes or no.
Honestly, I think there is a sector-wide disappointment and the hesitation of government to act on prevention that, as you've been talking about, some of the things that could make a difference. We have seen that where large-scale change is brought in, whether that is, like I said, the London Plan that the Mayor has done, whether that's some of the work that's gone on with the sugar levy, it does make a difference, and it just makes it easier for the healthy choice to be the easier choice. Not, and at the moment, in many instances, it's not.
No. Okay. And what progress has been made on the...
just before we move on to the next question, I'm just going to bring Assembly Member Buff in.
Certainly.
Thanks.
Sorry, Chair.
So is childhood obesity getting worse or better? Because you've said that the policy's working, and yet we're told that childhood obesity is getting worse. So what's working?
So, as Dr. Coffey was talking about, the factors that influence childhood obesity are very complex. There is no one single thing that will have an impact.
This is directly related to the TfL junk food advertising ban I'm talking about. Sorry.
So that has made a difference to intake of calories. What we can't do is say that it's going to solve childhood obesity. We have never claimed that. To truly track all...
Actually, the Mayor did.
It has a contributing factor. As I've just talked about, the reductions in calorie per week does make a difference.
Yeah. That study didn't include restaurant meals, fast food or snacks bought outside the home, did it?
The study on the ad ban, no, the evaluation was directly correlated and directly impacted on what the impact of that policy was.
And so who did you talk to? People who travelled on the tube or people who didn't travel on the tube?
So what did the evaluation look at? They did a study looking at, they took a confounding group of around 977 families who weren't in the London area and compared it with the London population, looking at changes in purchasing behaviour.
So the comparison was not a timeline comparison. The comparison was a snapshot of us, London, compared to another part of the country.
But it did look at pre and post the policy being implemented.
And were those people who were interviewed, did they travel on the TfL estate?
That's not so. I can come back to you and follow up the detailed methodology if that's helpful.
Because we'd rather want to know. I mean, it's rather daft using data from people who didn't experience that. You can still buy donuts on the TfL estate, can't you? You can still buy fast food on the TfL estate. All these things the mayor controls. What's the mayor going to do about finishing that? I mean, Dr. Coffey talked about the obesogenic environment that's been created around London, and how we're all being forced to eat high salt, fat foods. Can take down to London Bridge and we can have a nice Lola's cupcake there. And is it only the case that the mayor's only in favour of this ban as long as it doesn't affect his revenue stream?
No, absolutely. I think one of the challenges that was faced when we were talking about implementing the policy was a concern about loss of revenue. But interestingly, as we've seen, there wasn't a loss of revenue in terms of advertisement. Companies did, as we've heard earlier from other panel members, companies do have...
But you can still walk into London Bridge and see an advert for Lola's cupcakes. No criticism of Lola's cupcakes. They even do a vegan ones, Chair, and they're very nice. But you can still see that they're very high in sugar. You can still see that on the estate, but the mayor's taken no action about reviewing his estate, has he, to see whether or not he's creating himself an obesogenic environment.
So the retail estate on the TfL, or the retail TfL estate is something that is outside of my policy area. I know that they are doing a lot of work to look at food deserts.
Isn't it? Don't we have health in every policy?
We do. That's a separate unit. So we are looking at it. And like I say, there is a whole piece of work going on around how, on certain areas of London, there are food deserts, which they are trying to address through direct grant funding as well. One of the things we are trying to do is recognise that there is local authority ownership of advertisement across the transport system.
Sure, there is. Sure, there is. I'm talking about his responsibility, for which he can make a decision. He can make a decision if he is truly concerned about this obesogenic environment. He could take a decision to end those leases for high fat and salt outlets. Why doesn't he?
That's not a question that I can answer on his behalf. I can take that back to the team who lead on...
Dr. Coffey always leaves early from these meetings, and just when the really interesting questions come up, right? Because I am interested to know if there is this consistent approach with the mayor across all his responsibilities, and we were told health in every policy. Well, clearly it's not. He's only health in every policy as long as it doesn't impact the revenue stream into TfL. Isn't that the case? Isn't that the case?
Like I say, I can't answer on behalf of the mayor directly. I can take that back and come back if that's helpful.
Thank you.
Thank you very much.
Yeah,
one more thing.
Briefly, please.
Very quickly. Would you ban advertisements of strawberries and cream on the tube? Is that something that you think would be a good thing to do?
The advertisement policy has a very clear protocol that it runs everything through. So if it went through the nutrient profile model, which is a national system, and it passed, then it would be allowed to be advertised, but everything would have to go through that.
So if it didn't pass, we shouldn't be advertising strawberries and cream for Wimbledon?
If it didn't pass the nutrient profile model, it would not fit our criteria for being advertised.
Thank you very much for that very straight answer. You know, I asked the mayor that about 16 times at one meeting, and he refused to accept that was the case, because of course strawberries and cream is banned. The advertising of strawberries and cream is banned on the TfL estate, and those ads that are banned are often right next door to ones that are McDonald's that have some of whom they work to the rules to the extent that the thing that is being pictured on that advertisement on the underground does qualify, but it's still a burger, you know. Again, not a criticism of McDonald's. Not now they do a McPlant burger. But I'm just saying this policy just is so confusing and doesn't work, does it? The Mayor's approach isn't consistent. I don't expect you to answer that.
Yeah, I think we've well covered that, and we've well covered the vegan options emerging from London's restaurants. So I'll pass back to Assembly Member.
Chair, could I make a helpful suggestion that we regularly get that paper published by the London School of Tropical Medicine questioned, right, in various arenas here. It may be a good idea for us to get the team who produced the paper to give us a briefing on it and come to visit the committee so we can question them, because that's unfair on anyone else, right, to defend their methodology or their conclusion or how they did the research.
Well,
if we could
I'd
do
love
that,
to take it out with Dr. Coffey, but he's not here.
I think that would be a great idea. I'd love to speak to them.
Yes.
So if we can reach out, I think as an Assembly committee, I think everyone will be in favour. Thank you.
Great, thank you. Just the final question from me, right, CM, is what progress has been made on the commitment contained in the Healthy Place, Healthy Weight mission to ensure that by 2025 all London families will find it easier to eat healthy food?
So there's a numerous areas of work stream that the team have been working on. Some of them I've already mentioned. So we've been doing an awful lot of work, particularly on the super zones, and that is, as I've mentioned, exceeding our expectations and success. We're just about to go out to an independent evaluation for that. So when that's available, I'm happy to share what the evaluation of the super zones is telling us with the committee. The second area is breastfeeding, and as I mentioned, it's a piece of work which we are working with all of our partners on, to look at how we can improve the environment to be much more supportive to mums to breastfeed for longer. It's an area in London that we don't do as well as we could do. There is also work going on across other teams around the Healthy Start vouchers. We do know that in London the uptake of these is still low, and it's lower than across the rest of the country. And that is an area that we definitely want to continue to do more work on, particularly as that affects those families who are most in need. We've done other pieces. I'll mention two other things that we're doing. One is with the convenience stores, and that's a piece of work that I've mentioned where we're working directly with the commercial sector to look at how we can change the availability and affordability of healthy food and drink to children in the super zones area particularly. And then the fifth area that we're doing is we funded the healthy catering commitment as well, and looking at how we can get more businesses to adopt it and, as Caroline has rightly said, promote it to people so people are aware of it. We still have got more to do. We recognise that the mission doesn't end until 2025, so we've got a very deep commitment across partners and with the team to do more on that, but we are doing really well.
Thank you.
Thank you. Passing back to Assembly Member Russell.
Thank you. This is, again, I think, a question for Emma, although I'd be interested if anyone else has any views on it, which is there's the whole piece about messaging about healthy eating, where it kind of intersects with the issues around eating disorders. And, I mean, I noticed that the Mayor's obesity task force has been transitioned into an advisory group on child healthy weight, and so I'm wondering if that is if that decision to kind of change the name and to kind of change the group was taken in relation to kind of sensitivity around young people or any Londoners who may be living with these eating disorders?
I think it's an interesting question that we spent a long time debating. We recognise that there is a stigma related to being obese, and we wanted to address that by not badging people as obese or young people. We also recognising there's an increasing problem with underweight in London, so we wanted to make sure that what we were doing was focusing across the whole spectrum, not just stigmatising people by using that language, but, as you say, recognising that it's about healthy weight, not just about tackling obesity as well.
And is the Mayor's Advisory Group on Child Healthy Weight basically doing the same work that the Child Obesity Task Force was doing, or do they have a different remit?
It's a slightly different remit in the sense that their focus is directly on what the GLA group is doing. So the areas that the mayor has direct influence, that's the focus that they are putting their attention on, but thinking about what his role can be with the sector. We do have a very close interface with the delivery group, which was set up originally when the task force was launched. That is looking at wider factors that are outside of the mayor's remit. So it'll be things like weight management services or what local authorities can do. That brings together good practices and takes a whole system approach. Whereas what the advisory group to the mayor is doing is directly looking at what the mayor's responsibilities are with a particular lens on what we can do within the GLA group.
Mm-hmm. Okay, thank you. That's useful clarification. So my final question sort of picks up on, we've touched on plant-based food kind of through the meeting. There have been a few sort of references. And I'm wondering if the mayor's team, but also I'm interested in everyone else's views on whether there is scope to improve the health of Londoners by emphasising the benefits of plant-based foods, and whether that would also help with the cost of living crisis. Because actually, if you make lentil burgers and a salad, that is potentially more affordable to make than if you're making meat burgers with a salad or whatever. So just whether so for Emma first, but then for everyone to chip in, do you think the benefits of plant-based eating are really being maximised in terms of the health of Londoners?
I think anything that we can do to improve sustainability and affordability and nutritionness of diets is important. There is a lot of work that the Food Board is overseeing, underpinned by the local food borough groups. So just for an example, the Mayor funds food routes. So he has contributed £740,000 over 2 years looking at food insecurity. He also does things around kitchen social. So there is a lot of work going on across the system. I think there is more that we can do, you're right. And I know that we, within the task force, want to look at sustainability as one of the factors that we do think about as well.
And so within you're seeing plant-based eating as being within that sustainability piece. Okay, that's very helpful. Yes, Sonia, did you want to
add to that? I mean, it's great if we could encourage a more plant-based diet. It would address many of the nutritional inadequacies that we currently face as a population diet. We'd be increasing our fruit and vegetable consumption as well as fibre intake as well. It's more sustainable, as Emma's already said, and it can be. It's also more environmentally friendly, and it's not as expensive as meat, let's say. But I think it's also important to note, and we've seen it quite a lot in the research that we've done in my charity, is that a vegan option doesn't automatically equate it to being a healthy option. Yep. We're seeing increased availability of vegan menu items, let's say in the out-of-home sector particularly, but they do often, and you've already mentioned, Caroline, that they tend to still be quite heavily processed products. Yeah. Burgers, vegan pizzas, they're vegan, people will think they're healthier, but they're still really high in saturated fats and salts and sugars as well. And we've done a few surveys ourselves which kind of highlight that you could still be consuming way above your maximum recommended limit on salt intake and sugars and saturated fat as well. So it often has this health halo, let's say, where it automatically implies it's healthy when it really isn't. So we still need to address that.
So it needs we need a kind of big messaging piece about avoiding ultra-processed foods.
And it would be great
generally.
If we could make our own, bean burgers and stuff like that. But that kind of comes down
easy.
to the... But, I mean, I don't even know how to make a bean burger, so it kind of goes down to the kind of maybe education or information around that, which maybe we could increase. But then not many people have the time, let's say, or the knowledge or the kitchen appliances in order to do that sort of thing. So I'm probably better off making a stew more than a burger, let's say. But but yeah, something to that a more consistent messaging would be better.
Taz, from the community kitchen point of view, do you have any views on plant-based?
I do. My view is that any view should be respected and all views should be respected. So yes, I welcome people with a plant-based diet, but I also welcome people that like good red meat and poultry and are vegans and vegetarians. Everything should be looked at in a sustainable way. And I don't think one diet should be enforced and forced upon others and shame others. I don't believe in that. I believe everyone brings something wonderful to the table. But we should look at our food, where it comes from, the health and nutrition that we gain from that. We should match that with knowledge and share that knowledge. So any diet is welcome as long as it is a sustainable diet and there's education about the nutrition element. That's what we emphasize on.
So it's about the not the ultra-processed stuff, making sure that it's real food, but whatever, wherever it comes from, and the sustainability being the top.
It's true. It's about where your food comes from. I'm all for seasonal food. I don't still understand how you can have an avocado for 365 days of the year and not question where it's come from. I welcome it, I love it, but I think these are the conversations that we should be having. Where is our food coming from? What we can do more locally to understand where our food comes from. We grow everything in our gardens, we consume everything in our gardens, and that starts bringing a different education level. And Cavallo Nero sometimes is more expensive than a breast of chicken.
Yeah.
That's the world we live in.
Sadly. Thank you. Ruth, did you want to?
Yeah, I just want to say on a personal level, I think most of the diet I eat you could call plant-based, but I wouldn't put myself in a plant-based kind of bracket because I think that implies a lot of substitutions and highly processed food. So I think yes, all foods are welcome, all foods should be sustainable, and I think people should be encouraged to cook their foods from raw ingredients. So I think ultra-processed foods should be limited as much as possible, and obviously they're the ones that are the cheapest and make the most profit to food companies, which is why they're so readily available and so obviously very cheap. And I think we need to give an idea to, well, we specifically give the idea of young people what their diet should consist of and try and encourage them to make that what they eat. And I think if you look at the Eat Well plate, over 30% of what you are supposed to eat in a day as part of your diet is fruit and vegetables. Another third of that is grains, and the protein, which we're all very fascinated with, doesn't need to be such a big part of our diet. And making them understand that this is what they should be eating and thinking about where that food actually comes from is key. And yes, it should be more vegetarian. The meat should be, I think, fewer and of more value. But yeah, like Taz said, kale is sometimes more expensive than chicken, and that's hard to beat.
Yeah. Peter, did you want to chip in on this one?
Only to say that, and I'm no chef, but it is ironic that the additives, the salt, the sugar and whatever, arises when we all these products are made to mimic meat products. You automatically talked about a burger. We talk about, plant-based sausages and that sort of thing. There's a strange gap in the education that says, you have to make it into a meat-looking product. So I think there is a gap in the education about, I similarly couldn't make a bean burger. I'd struggle to make a bean stew, probably. But there's something that values those products for themselves, and some of the way they're prepared and cooked, rather than making them, trying to process them into meat-looking products, and therefore adding the salt and sugar and all the badness in.
Yeah. Well, thank you. And I think that piece kind of gives us some thoughts about things we might want to ask the Mayor to use his communication channels on, in terms of spreading those messages about the importance of avoiding ultra-processed foods is something that's coming over loud and clear. Thank you.
Thanks, Assembly Member. And I'm sure with Assembly Member Harani not being here, he'll be glad someone else was holding a plant-based flag as well. So passing over to Assembly Member Boff.
Are you aware of
18 and
18 to 19? Yes. Pulled the curtain away from the magic there for a minute, didn't I? Are you aware of any of the Mayor's initiatives to reduce barriers to healthy eating for Londoners? And if so, what do you think the impact of these has been? And let's start with Mr. Rogers.
I think that's quite a difficult one for me to answer, because I live in a micro environment rather than a macro pan London environment. I mean, I am aware of the London food strategy. I am aware of the health inequalities strategy, but it's very, very difficult for me to look at, impact directly. I have no way of measuring take-up, really.
Mr. Soroko?
Probably a similar answer. I am aware of some of the initiatives, but I don't feel like they impact our work per se.
Mr. Khan?
I'll have to echo what my friends on the right have said. We understand the policy, we've read the policies, we know what's the message. How that trickles down back into organisations, grassrooted, and dealing with communities is still a miss. So I think there's more that can be done.
And, I'm interested in those.
Can I just come back on
Mr.
that?
Rogers,
I wouldn't say that sounds, I think, a little bit like a criticism of the Mayor's policies, which from my point of view it's not. But there is a massive information overload out there. There is endless information on healthy eating. There's endless information on all of these things. But how that translates into action is very, very difficult to quantify. So it's that gap that's not being bridged between policy and strategy and what happens when mum cooks at home.
Yeah.
There's just a massive gulf in the middle.
So has the Mayor provided any support to your organisation?
Personally, not
the GLA, the Greater London Authority.
Not directly in my case.
Yeah. Mr. Soroko, no. Mr. Khan.
So some of the community courses that we deliver are from the AEB budget.
Oh, right.
And so, yes, we are a direct beneficiary, and we do run health and well-being with nutrition cookery classes that we do. So that is run by that budget. So, but I agree with what Peter was saying. There just needs to be more of a driven approach if you want to access the communities, because the papers and the policies are great. They're there. We understand it is an overload of information, but there just needs to be that connection with boroughs and the GLA a bit more. That's what I feel.
Okay, that's a very, very useful answer. Thank you. And finally, Ms. Pombo, what further action could the Mayor, central government and civil society groups take to reduce the barriers to healthy eating for Londoners? I haven't asked those civil society people because they're already doing loads. So what do you think could be done?
That's a loaded question, isn't it? I'm not going to pretend I know the answer,
right.
or have the magic solution to everything. But there are obviously some things that have worked. Emma's already talked about. I think the restrictions in advertising on underground, I think, has been really successful. There's quite a lot of work that another charity has looked into it. Sustain. They've found some really significant reductions in calorie intake within families, 20% sugar reduction, 20% reduction in sugar purchases, I think they've found, and they've kind of modelled that to see what kind of impact that would have in terms of savings to the NHS, which would be really good. I encourage, if you want to know more about that, I encourage you to reach out to Sustain. They'd be a really good organisation to talk to on that. And as Emma said, there's been no loss in sales. So whilst all these things, this kind of incentivises, I think Dr. Soroko said, it incentivises companies to make these changes so that they can continue to make sales and make profits, etc. That could probably be expanded if it hasn't already. I'm not aware if there's any plans for that to be expanded to kind of. I think actually there's a few boroughs, so it's not consistent across London. But I believe in the borough that I'm based in, Merton, they've expanded like the advertising restrictions to great, outside of the transport systems. So that could be something that is done widely across London, I believe, and just any kind of measures that address the environment that we've been going on about. It's great that there's local communities that are kind of doing stuff for more locally, but if we can address the environment, be that through the advertising restrictions, be that through other measures in terms of encouraging the out-of-home sector to improve their offering as well, I think would be great.
Thank you very much. And in closing, I just noticed there's a news report that a resident of Isleworth, Miss Sarah Merker, has just completed a 10-year plan to have scones every single National Trust outlet in the UK. And after this committee meeting, I'm not sure whether or not we should celebrate her or disapprove of her. But I think that's quite a thing, isn't it?
It depends on the cream content.
It does depend on the salt and sugar content.
Thank you, Assembly Member Boff. And I think we've got a few minutes. So just in closing, obviously we are now running our investigation on healthy eating within London and the outcomes from that. I just wanted to give all our guests today the opportunity to let us know what outcomes would you like to see in terms of things we're asking from the Mayor or government. What is there, if there is any, what are those outcomes that you would and recommendations you'd like to see? I'll go back perhaps to you, Sonia.
Back to me. I will focus on the environment, less so on the individual and what actions you can take to I mean, obviously, what the individual can do is of course of importance, but if we can address the environment to make the healthier choice, the easier choice for all, it will reduce it will hopefully combat those health inequalities and those widening inequalities that we're seeing between different demographics. So more regulation, more incentives for companies to improve.
Thank you, Sonia and Taz.
I believe that the conversations between local authorities and the GLA needs to be a bit more streamlined. I think when you speak to local authorities, sometimes they're often disconnected with what's happening at City Hall. I work with local authorities at many levels, and there's a connection there that is kind of missing. And if that was bridged, I think then we can be a bit more efficient in what's happening here at City Hall, what the local authority should see as an advisory or something that they should adopt, and then that then trickles down into the community and the boroughs that we work in. So I just think a stronger connected community message would be better.
Thank you. Ruth.
So first of all, I welcome the initiative to make sure that there aren't unhealthy food outlets around schools, because I think that is a really big key, and also the funding to make school food free for all. But I would hope that it's not just for 1 year, and that it can also go over to the secondary school sector, which I think that's where young people have a lot more independence in the sense of they go out of school to purchase food, and that's where a lot of unhealthy eating will come into play. So I think free school food across the board and forever would be my cause.
Thanks, Ruth. And Peter?
Yes, a couple of things. It's fantastic that the GLA has found 130 million to actually to fund this project. That is an amazing initiative. So well done on that. And if there is an appetite for funding, I think my plea coming from the local and the community sector would actually be to see that money cascade down. I think the voluntary sector is very good value for money, and I think, as we discussed, local communities are very good at picking up and meeting their needs. So if there are funding opportunities, my plea, I think, would be to see that money cascading down. Dr. Soroko made a very impassioned defence of ULEZ, and it just occurred to me while we were meeting that, I mean, nobody doubts the intent. Nobody would speak against that. But the intention also wasn't to raise revenue or tax local charities. So perhaps a proportion of funds that are raised could be fed back into the whole healthy eating concept. You know, if it's about saving lives, improving lives for young people, perhaps a percentage of that money could be sent round the system. And my plea would be that at least a proportion of that feeds down to the voluntary sector, which is good value for money and can meet local needs.
Absolutely. Thanks, Peter. And I'd like to thank all our guests for your contributions today, and also for the amazing work that you are doing in London as well. Can we note the report and today's discussion? Noted. Can we also delegate authority to the chair in consultation with group lead members to agree any output from the discussion? Agreed. Brilliant. And moving on to the Health Committee work programme, can we note our work programme? Noted. And can we also note the additional activity undertaken since our last meeting, the site visit and informal session with the London Ambulance Service, and the site visit with Cycle Sisters? And you know, all those that went on Monday, I know we had a fantastic time, and I think Assembly Member Russell wanted to say a quick thank you too.
Yes, I just wanted to sort of put on the record our thanks to Cycle Sisters for welcoming us. This was a Muslim women's cycling group in Redbridge, and we spent the morning cycling around with them. But we learned through that cycling and chatting with people that actually it's about far more than cycling, far more than learning to ride a bike. It's about the sociability, the mutual support that people were providing each other, the mental health support, and it just was a really fantastic visit. So yeah, big thanks to Cycle Sisters.
Yeah, massive thanks for them for inviting us, and also to the officers as well that within the GLA that set that up. I should have said to my guests, there is only a couple of seconds that you're not going to be sitting here, don't worry. So on to the date of next meeting. The date of the next meeting of the committee will be confirmed at the London Assembly's annual meeting on the 4th of May 2023. On any other business that the Chair considers urgent, I have no urgent business, and I therefore declare this meeting to be closed.